Hayden Panettiere's memoir was released just this week, and she has been speaking about her story in various forums, from the New York Magazine to Jay Shetty's podcast. But the line that stands out to me is something she actually said 3 years ago on Good Morning America. Hello and welcome to the Dr. Suzette Glasner podcast. Don't forget to hit like and subscribe to my YouTube channel if you haven't done so already.
Where did you turn to for support?
The bottom of a bottle. I didn't have any negative feelings towards my child. I just knew I was deeply depressed. And I didn't know where, the alcoholism was ending and postpartum was beginning. And
now there's so much to unpack in those few seconds. From the confusion of being a new mom, which is supposed to be one of the happiest times of your life, and yet feeling so depressed, to the way that alcohol made things worse instead of better, to the stigma that keeps people from seeking the help that they so desperately need during a time like this. And that's where I really want to spend our time today. Hayden's story comes at a time when, thankfully, the conversation around maternal mental health is widening. World Maternal Mental Health Day was just a couple of weeks ago, and this was a global awareness day that was developed a decade ago now to shine a light on the mental health struggles that affect up to 1 in 5 women during and after pregnancy. And the part of this conversation that gets the least attention is the overlap between postpartum depression and substance use, which is why I, both on a personal and professional level, feel so grateful to Hayden Panettiere for her openness and willingness to discuss her battle with both of these conditions. So Hayden's story is one of many we've heard in the media. Brooke Shields, Drew Barrymore, Adele, Serena Williams have each described something most mothers experience privately and rarely say out loud. I'm an addiction scientist and clinical psychologist, and today I want to take you through 3 things. 1, why postpartum depression so often occurs with substance use. 2, who is most at risk. And most importantly, what we know works to prevent and treat both of these conditions. So let's just start with what postpartum depression actually is. Postpartum depression is more than the baby blues. Baby blues are sort of a mood shift that follows the hormonal shift of going from being pregnant to not pregnant, which is quite profound, actually. And that's a mood disruption that affects up to 80% of women in the first couple of weeks after giving birth, and it's perfectly normal, expected part of the course. Postpartum depression is actually a clinical syndrome. So it's a clinical depression that emerges within a year after giving birth. And it persists with symptoms that are severe enough that they cause a person to have a difficult time functioning in their important roles. And now they've added the important role of motherhood to their life. It makes it hard for them to care for their baby and also for a mom to care for herself. So the classic symptoms are many of those that you see with clinical depression outside of motherhood. So a persistent, sad mood, a loss of interest in things that used to bring joy. So we have a clinical term for that, which is anhedonia. Difficulty sleeping beyond what infant care explains, and changes in a person's appetite. So those are kind of the clinical depression-like symptoms of postpartum depression. But then there are some more kind of maternal and motherhood specific symptoms. So one of them is having a difficult time bonding with the baby. Another is just this feeling of intense anxiety or panic or profound guilt. It's this sense of not feeling the way you're supposed to feel during this time of your life. And this can be accompanied by what are referred to as intrusive or scary thoughts that can leave a person especially a mom feeling very ashamed, anxious, or stressed. And the thoughts fall into a couple of categories. One is about something bad happening to the baby. And everybody worries about that to some extent when they're a new mom, but this is sort of taking that up a notch in terms of the intensity, the frequency, the intrusiveness of those thoughts, and the hard time that a mom will have sort of shutting them off. So worries that the baby's going to get hurt somehow. Some examples are by sudden infant death syndrome or suffocation, which is a real thing, but moms with this condition will sort of magnify the likelihood of that happening in their mind. A fear that the baby will fall off of the changing table, a fear that the baby will drown in the bathtub. But the key is just being very preoccupied with these thoughts and not being able to shut them off. So that's one category. The other category is thoughts of just not being equipped for motherhood or family life. So in the most severe cases, a new mom can have thoughts of harming themselves. And the prevalence of this condition of postpartum depression is actually quite striking. So roughly 1 in 8 new moms experiences postpartum depression. So that's an estimated 600,000 women in America alone every year. And honestly, those are conservative numbers and are likely an underestimate because these symptoms are heavily underreported due to stigma. Sometimes moms fear that they're going to lose custody of their baby if they admit to some of the dark thoughts that they've been having. There's also this cultural pressure to be okay for the baby, to be strong for the baby. So Hayden actually could have slipped into this sort of undiagnosed, unrecognized group of women with postpartum depression, and here's why.
I felt like I was walking blind, and there was nobody there that was really able to support me in the way that I needed to be supported.
Thankfully, she did seek out and respond positively to treatment, and I'll discuss the different types of treatment that we know to be effective for postpartum depression just a little bit later. But postpartum depression is often undiagnosed and neglected. And the consequence of that can be very serious and life-threatening when suffering moms go untreated. So suicide following non-treated postpartum depression accounts for about 20% of postpartum deaths. So who's at risk for this? Because we do know that there are a number of predictors. So you can actually anticipate if you're somebody who might be particularly vulnerable to postpartum depression. So one is having a personal or family history of depression or anxiety. So before pregnancy, having significant life stressors during pregnancy. So within the year before birth, so these could be financial stressors or relationship instability or grieving a loss. Childhood trauma is also a predictor. And then probably the most modifiable predictor is a lack of social support. So that's something you can actually proactively change prior to a baby arriving. And that can be very impactful because that feeling of being alone and isolated with this very new set of responsibilities that are exhausting and overwhelming can make all the difference in a person's mental health after the baby is born. An unplanned pregnancy is also a predictor. And then with respect to substance use, either a history of substance use prior to the pregnancy or active substance use, so drinking or drug use during the pregnancy, also raise the likelihood of experiencing postpartum depression. Birth trauma is another major risk factor that often just gets understated. And Hayden's birth experience is a really good example of this. She went through 14 hours of labor, followed by an emergency C-section that took several hours. She had medical complications during the C-section. Her blood wouldn't clot properly. She had an infection. This is exactly the kind of medical trauma profile that substantially elevates the postpartum depression risk. And if you think about a traumatic or near-death experience that Hayden and other women have had just from the delivery process itself, that is a lot to recover from physically and psychologically. And then when you layer on the hormonal changes of the pregnancy being over, sleep deprivation, And then the pressure to bond with the baby on top of it, that can all be too much for many women's stress systems to absorb. Let's talk a little bit about why postpartum depression and addiction so often go together, because this isn't discussed very frequently. Women with any substance use during pregnancy have elevated rates of postpartum depression. So those rates run around double the general population rate, so almost 30%. So for women who have a pre-existing addiction prior to the pregnancy, about 50% of them will develop postpartum depression. And in Hayden Panettiere's case, we know that she has openly discussed the onset of her struggles with alcohol use and substance use many years prior to her pregnancy. So that placed her at elevated risk, combined with all these other risk factors that we know of. So the postpartum depression made her even more vulnerable to developing addiction thereafter, because she already had signs of it before her pregnancy.
I mean, when you see a happy-go-lucky girl for years suddenly on the floor in a puddle of mess and alcohol, you got to know something's wrong.
So Hayden's situation is more common than most people think. Among women with postpartum depression, the rates of binge drinking are 3 to 4 times higher than non-depressed postpartum women. So, and then women with 6 or more stressful life events in the year before giving birth have a 67% rate of developing problematic substance use postpartum. So why does postpartum depression co-occur with substance use so often? So there are 3 reasons. The first is self-medication. So women are feeling exhausted during this period of their life. Sometimes they feel isolated as a mom, and they're just seeking relief, and they are drinking in order to escape all of that stress, that exhaustion, and some of the negative emotions that they are preoccupied with. The depression then worsens because alcohol itself is a depressant. So while they're using it to self-medicate, it's actually worsening the very problem they're trying to gain relief from because of its biological effects as a depressant. The second is what we refer to as shared biology. So depression and substance use dysregulate some of the same reward and stress systems. And then you combine that with the hormonal shifts after pregnancy ends and the sleep deprivation, postpartum biology amplifying that vulnerability. The third is what we call the shared environment. So the same stressors that are driving postpartum depression also drive substance use. And so those conditions tend to concentrate in the same people. So the good news is that prevention and treatment both work. So along the lines of prevention, any OBGYN who is practicing in an evidence-based way is going to be screening for postpartum depression and problematic substance use before, during, and after the pregnancy. If you or someone you love is pregnant and you have concerns about their mood and or their substance use behavior, ask them if they've talked with their doctor about this, talk to them about how common it is, and the fact that treating prior depression before or during pregnancy substantially reduces the postpartum risk. If you or someone you care about is pregnant, make sure that if they have depression or have a history of depression, that it's being addressed proactively before they give birth. The other is building social support before the baby arrives. So this is a really underrated kind of intervention, but new moms who have a partner, who have a family, a community who they can count on do meaningfully better than moms who feel isolated and alone. And then limiting alcohol and other substance use during pregnancy is protective not just for the baby, but also for the mom's mental health. Now, when postpartum depression has already developed, we do have effective treatments, including some that have been game changers recently. So first, we'll just talk about therapy and the medications that have been around for quite a while. So cognitive behavioral therapy and interpersonal behavioral therapy have decades of evidence for postpartum depression and are typically kind of the first line treatment approach for mild to moderate cases. Then we have medications that fall into the class that we call SSRIs, which are selective serotonin reuptake inhibitors, meaning they act on the brain chemical serotonin. And these are well studied and safe in pregnancy and breastfeeding and are very appropriate for moderate and in some cases severe cases. Now, there are two newer medications that were FDA approved specifically for postpartum depression. So if you know somebody who has not responded to some of these other treatments, this might be worth investigating. So there are these rapidly acting medications. One of them is called brexanolone, and that is an intravenous infusion that was approved in 2019. That was the first one. Zuranolone is a medication that's taken orally versus the IV infusion of brexanolone. This was approved very recently in 2023 and is the first oral medication specifically indicated for postpartum depression. Both of them produce very rapid relief. They can produce relief within days rather than waiting the weeks that the sort of more classic and standard antidepressants usually take. The drawback is that they can be very sedating, so you often can't drive or you can't do things that aren't safe when sedated on them. So you have to really kind of weigh out the risks and benefits. But for moms with postpartum depression and substance use, it's really important to treat them at the same time. You need to treat the substance use issue and the depression together and not one after the other. That integrated approach has the best outcomes. So there's one more moment from Hayden's piece that I would like to leave you with. She describes a conversation with someone close to her who said that happiness is a choice and that she needed to work harder to be happy and to think about the good things in her life, like her daughter and her talent. And Hayden's response, understandably, in her own words, was, so do you think that means that my depression is a choice? Do you think I'm choosing this for me and my daughter?
What do you want people to know about postpartum depression that you think they miss?
That it's real, that it's not something we make up, it's not something we want, it's not that we've lost our marbles, and it's not something that we want to go through. And we're not lying when we tell you something's wrong. We don't have control over this, and this would be the last thing that we would ever want to experience or go through it. We want to be with our brand new child and be filled with joy and feel like the luckiest person in the world and capture every moment. For anyone to think otherwise is just misinformed.
So in that clip, you can really feel her fight against the stigma and judgment around postpartum depression in the way that she spoke on Jay Shetty's podcast. Depression is not a choice. Postpartum depression is not a choice. It's a biological condition, and alcohol use that develops in the context of untreated postpartum depression is not a moral failing. Moms like Hayden, Brooke Shields, and Drew Barrymore have done the harder work of saying out loud what so many women feel privately. You are not failing. You're experiencing something that 1 in 8 new moms experiences, and that for far too many of these moms ends up involving substances that ends up making it worse. So if you're a new mom or if you love one, please know that this is a treatable condition, that you're not alone, and that asking for help is the first step in the direction of healing. Resources at the end of this episode description will include the Postpartum Support International Helpline, which is staffed 24/7 and connects callers directly to people who are trained in postpartum mental health. I want to thank you for being here. I hope you learned something valuable that you can take back into your life, and I look forward to seeing you next time.